I am here today to talk about another potential disaster to our country, although it's of a completely different kind and not a physical disaster made by nature, but a disaster potentially of our own making, one that can be prevented and avoided. I'm horrified that I am here again, fighting back again against a proposal that would devastate the health and finances of so many families in Connecticut and around the country. This proposal, the so-called Graham-Cassidy measure, is cruel beyond measure. It is undoubtedly the most extreme proposal we have seen from my Republican colleagues in their political crusade to destroy the successes of the Affordable Care Act. How illogical and irresponsible to pretend, as my Republican colleagues continue to do, that any proposal that cuts billions of dollars from Medicaid and decimates important Affordable Care Act provisions, protecting people with pre-existing conditions and high medical costs, will somehow result in a better health care system. In fact, it will vastly diminish and in some respects destroy that system. The Republican obsession with repealing the Affordable Care Act and gutting Medicaid really has to end. And it has to end today. My constituents in Connecticut made themselves heard loud and clear in saying that past proposals were sickening attempts to ruin the gains we've made in providing better health care to many people. Those folks who came to town meetings and emergency field hearings, who wrote and phoned, who made their views known, were the catalysts in defeating these ill-advised efforts before. I can assure you that once again, they will be heard. They will make themselves heard. And they will once again guarantee its defeat. Under this lethal proposal, hundreds of billions of dollars will be cut from Medicaid. Those severe cuts would cost Connecticut more than $2 billion by 2026. In 2027 alone, without authorization of funds, that reauthorization, Connecticut would lose $4 billion. In 2027 alone, $4 billion would be lost to Connecticut without reauthorization. Those are not just dollars. Those are lives. They are hundreds of thousands of lives. And this bill would end the patient protections that countless Americans have come to rely on in their oftentimes life-saving care. States would allow insurance companies to reimpose annual caps and lifetime limits. Insurers could decide to drop essential health benefits like maternity care or mental health services, and those with pre-existing conditions could see their premiums skyrocket, leaving them with no affordable options and nowhere to turn. It would be a humanitarian catastrophe. That's not hyperbole. That's not exaggeration. That's reality. In a recent report on this legislation, there was a finding that a person with metastatic cancer would see a $142,650,000 premium surcharge. A pregnancy would mean a $17,320 premium surcharge. And during a deadly and unrelenting opioid epidemic, people struggling with substance abuse disorders can expect to see a $20,450,000 premium surcharge. These effects are immoral, incomprehensible. They will lead to many, many Americans needlessly losing their health insurance and very likely their lives. When I see the true effects of this bill, what they're likely to be, I can't help but think of a little boy in Connecticut whom I've mentioned on the floor before. He is 7-year-old Conner Curran. Conner has Duchenne muscular dystrophy. It's a chronic and terminal condition that will slowly erode his motor functions. Unless there is a cure, and none exists now, this disease eventually will take his life. He is a young man of extraordinary courage and strength, and so is his family. His parents have told me that although he appears healthy, he will slowly lose his ability to run, walk, or even hug them goodnight. In fact, earlier this summer, just days before the last Republican effort to gut Medicaid and repeal the Affordable Care Act, which failed in the Senate, fortunately, Conner's family had 2 lifts installed in their home so he could move up and down the stairs more easily. A video shows Conner's infectious smile as he tries out the new lift, not fully understanding the disease that necessitates it, but enjoying his newfound freedom to be just a little kid. His mom wrote that this experience shows just how important Medicaid is to their family. As Conner gets older, he will only need more and more help, more medical services and equipment, and more financial support for his family to enable that kind of care. He will need a loving and compassionate healthcare system that will protect and care for him when he is at his most vulnerable. That's the only way he will have a fair chance at life. And this bill, to put it mildly, deprives him of that fair chance. So I question whether my Republican colleagues could look Conner in the eye, or his family, and explain to them why protections for children with pre-existing conditions should be weakened, diminished, eviscerated. I question they could look at Conner's smile and tell him why Medicaid will be eliminated. That's the program that one day will make sure he has everything he needs to live. It's the program that should be enhanced, not cut by hundreds of billions of dollars. Tell his parents why the insufficient or temporary funds that my colleagues have proposed to replace Medicaid will run out in 10 years. As the shadow of Medicaid that you have left behind goes dark, see whether Conner's family cares about your legislation. See if your empty promises leave them reassured. I can tell you that Conner's parents are 2 of the kindest, most wonderful people you will ever meet. They are also among the hardest working. They worry about countless things every single day. They worry about Conner's slowing body and the medical research that could save him before that pernicious disease takes his life. They worry about his independence. They worry about his 2 brothers and the toll that this awful disease will have on them, and they worry about those stairs, the ones that will have a lift. I promise you, Conner's parents worry nonstop. All of us worry about our children. They worry about Conner unceasingly. So I'll say it again. I'm ready to work with all my colleagues in solutions to the healthcare problems that our country faces. They are urgent and important and critically important to address now. But I refuse to stand silently and let this cruel proposal give Conner's family even more reason to worry. We as a country are better than these reprehensible proposals. First, repeal and replace, now Cassidy. They are all different versions of Trump care, which is a catastrophe that will lead to humanitarian crisis. This heartless proposal should be put behind us. We should work together, as our colleagues, Senator Alexander and Murray, are doing, and at least for the moment, give Conner some assurance that we're making things better for him, not worse. That the parents who worry about their little boy know that at least we are moving in the right direction, not rolling back the progress we've made.